CBS News correspondent Byron Pitts on assignment for 60 Minutes.
Dr. Paul Farmer. More than 20 years ago, he and a few other great minds created a charity called Partners in Health. In the years since, they've revolutionized the delivery of health care worldwide, saving millions of lives in places where no one thought there was any reason for hope.
The idea that because you're born in Haiti, you could die having a child. The idea that because you're born in, Malawi, your children may go to bed hungry. We want to take some of the chance out of that.
Dr. Farmer invited us to central Haiti, where he discovered his life's work 25 years ago. That meant a 3-hour, jaw-clenching, teeth-rattling ride on an unpaved road from the capital city to the hospital. The squatter settlement of Kanj is one of the poorest parts of the poorest country in the Western Hemisphere.
Bonjour, messieurs, dames.
The desperate need Paul Farmer saw here as a young man inspired him and 4 friends to create Partners in Health. They raised money and built what's become the largest hospital in central Haiti.
How many lives do you think Partners in Health has saved?
In medicine, we say TNTC, too numerous to count. Too numerous to count.
What began as a small, understaffed, ill-equipped clinic in 1985 today has 100 inpatient beds, an array of specialists, and 3 operating rooms. They have nearly 2 million patient visits a year. And the medical care here is free. For Paul Farmer, health care is a human right. He wants to show the world that children, for example, don't have to die of treatable illnesses like tuberculosis or malaria. They treat those diseases every day.
Do you have any idea how many people around the world die from treatable diseases?
Well, probably about 10 million a year. Because if you look at...
From treatable diseases?
Oh, yeah. Oh, yeah.
Things that if they were in the U.S.
Let me just give you some numbers. Just from AIDS, tuberculosis, malaria, and women who die in childbirth, I bet that's 6 million.
Haitians are so desperate for medical care that each night people sleep on the ground outside the hospital just waiting to get treated. We were there when Dr. Farmer got word that a woman dying in childbirth was being prepared for an emergency C-section.
So this is a 45-year-old woman who has 11 children who's hemorrhaging right now and has placenta previa.
The surgical team was made up entirely of Haitians. Partners in Health staffs its hospitals with as many locals as possible, so they're not dependent on Americans. In this case, the baby was delivered alive. For the mother who'd lost a lot of blood, it was touch and go. Dr. Farmer checked on her after the operation.
She's gonna make it. Thumbs up.
That same woman, same circumstances 25 years ago, what would have happened?
Well, she wouldn't have made it.
What does that tell you about your work?
It tells me that if you set your sights high and if you stick with it, you can make real progress. That's what it says to me.
In fact, Paul Farmer has made astounding progress. Partners in Health has expanded and now works in 9 countries, including Peru, Russia, Mexico, and 3 countries in Africa. With 6,000 employees worldwide, their budget of $50 million is barely enough to keep it going.
No cesareans today?
Yeah, we had 2 in the morning.
Dr. Farmer spends most of his time commuting between the hospitals in Rwanda and Haiti. One of his priorities, train a new generation of doctors to follow in his footsteps, physicians like David Walton.
I look at you, 31 years old, medical degree from Harvard, can make $1 gazillion back in the States, and you're in Haiti. What do you get out of it?
There's nothing that I'd rather be doing with my life. Absolutely nothing.
On this day, Dr. Walton was visiting 10-year-old Claudine, suffering from a damaged heart valve. Her family and neighbors showed up with their list of ailments. There are no short lines in Haiti. Some of Claudine's siblings were also sick from sleeping on a muddy floor, including the parents. 12 people sleep in this one room.
You know, in the scheme of poverty in rural Haiti, this is pretty bad. You know, we're on the lower end of the spectrum. 10 kids living in a place like this with no material possessions and a very, very sick child.
Even for the well-trained, this is difficult.
I can't imagine, I can't imagine turning my back on something like this. I mean, some people can, but I can't. And I won't. And you know, this is my life's work.
There was no happy ending for this story. Claudine died not long after Dr. Walton's house call. Take AIDS, for example. In the late 1990s, the disease was ravaging the people of Haiti. Conventional medical wisdom was there's no point in giving AIDS drugs to the poor in third world countries. But Dr. Farmer wouldn't give up on his patients. He raised money and gave them drugs anyway. And look what happened. This is Joseph. And this is Joseph just 6 months after starting treatment. And here he is today, 5 years later, and feeling fine. And the same kind of transformation happened in patient after patient.
When Paul started treating people in 1998 in Haiti, everyone said he was absolutely nuts, impossible, can't be done, and forget about it.
Dr. Jim Kim is a professor at Harvard Medical School and one of the co-founders of Partners in Health.
And here we are, not even a decade later, where the goal is to treat every single human on the planet who needs HIV treatment with the right drugs.
And look at this man stricken with tuberculosis. They saved his life and thousands like him. Farmer and Kim figured out not just a new way to treat multi-drug resistant TB, but a cheaper way to provide the medicine. Their breakthrough has become the new standard to save the lives of people around the world.
You were able to lower drug prices. How is that possible?
I realized very quickly, but these are all old generic drugs. Drug procurement specialists who had contacts in India who said, we can make these drugs for 1/100th of the price.
But drugs only work if people take them. So Partners in Health came up with the idea of hiring community health workers, fellow villagers. They visit the sick at home every day, making sure they take their medicine. The result, says Farmer, is that their patients with AIDS and TB stay healthier longer than many patients in the U.S.
Yes, there are people here in central Haiti who get better care for certain diseases than they would, in parts of the United States.
Come on.
No, I'm absolutely serious. I've seen it.
Just wanted to remind you of our visit and that I'm on my way, okay?
A program so successful, Partners in Health has exported the model of using community health workers to American communities, like Roxbury, Massachusetts.
You've been an inspiration to so many people.
Thank you.
Paul Farmer's success has made him a celebrity in the world of global health care. He won a MacArthur Genius Award. Heady stuff for a man from humble means. His mother was a grocery store cashier, his father a school teacher, who chose an unconventional lifestyle for his family.
You grew up on a bus?
He came from a family of 8, and he said even though it was crowded on that bus in Florida, he didn't feel deprived, but rather adventurous.
You ate your meals on the bus?
We did. Until we moved on to the boat.
Lived on a bus for a while, then on a boat?
Yes. With a tent in between.
How did that kind of upbringing shape who you are now, you think?
Well, when you grow up in those conditions, surrounded by affection, and but not having a lot of things, because you can't put a lot of things for 8 people in 28 feet of space, then you get pretty resilient.
He went from the bus to a scholarship at Duke University and then to Harvard Medical School where he's on the faculty. He married a Haitian woman and they have 3 children. Though he travels the world, Paul Farmer insists Haiti is home. His services are free, but he still accepts gifts like the occasional rooster. Before we left Haiti, Dr. Farmer insisted we meet one last patient. This is Jolette Sano, 35-year-old cancer survivor. The chemotherapy worked, her leukemia is in remission. Sometimes his work does get to him. It happened when he read Jolette's thank you letter.
I want to take this time to show my gratitude to you. As for me, I'll read it to you later.
This is hard for you sometimes.
It's a lot. I mean, everybody should have access to, medical care. And, it shouldn't be such a big deal.
For the sick, the poor, the forgotten in Haiti, Paul Farmer is a big deal.
Hey, mana.
There's a Haitian expression some of his patients use when he's away. We miss him, they say, like dry earth misses the rain.